The topic, as you can see, says, why has maternal morbidity and mortality not reduced despite multiple interventions? I first of all listened very well to the megalomaniac introduction by my son, Ezebiel. But for me, I tend to simplify what I'm doing. The first part of my own looking at it is, who are you?
And today, our specialty is organizing our what they call Faculty Day celebration. I am the chairman of the local organizing committee. So I'm in charge of whatever we've done here, working with my committee and the subcommittees. We organize and package this event that is ongoing now. So those two things are key. Universal health coverage and financing, number one, and two, improving our primary health care. If we're able to do that, I think less women will die because of pregnancy.
Well, I'm Emeritus Professor Benjamin Chukwuma Ozumba, formerly 14th Vice Chancellor, University of Nigeria. Presently, Nigeria does not occupy an enviable position in maternal and child welfare. We have one of the highest maternal deaths in the world. So I'll prefer that, if possible, we should have a state of emergency, so that, as you said, the authorities will look at opportunity to crash it down. The present very high maternal deaths and neonatal deaths to one of the lowest. It is achievable.
I am Professor Ayodeji Ayotuni, the faculty chairman for Faculty of Obstetrics and Gynecology, National Postgraduate Medical College of Nigeria. Well, the major take home is to remind every obstetrician and gynecologist that our first objective is to reduce maternal morbidity and mortality wherever you practice, to be able to exhibit the utmost professional attitude and ethics about the ethics of the profession. We need to focus and refocus on reducing maternal morbidity and mortality. There are no two ways to it. Our women folk are dying unnecessary deaths. So those of us who are in government, who are involved with policymakers, we should ensure that these things are done properly. So that's the message for today.
Professor Okechukwu Ides. I'm a professor of obstetrics and gynecology, and currently I am the president of the Society of Obstetrics and Gynecology of Nigeria. We want to look at something that is topical, something that is important. In Nigeria today, women die during delivery, during pregnancy and childbirth, and the rate at which they are dying is alarming. And so every stakeholder is concerned. The women themselves, their families, the federal government, professional associations like our own, and what is more, the rate is the highest in the world. So because of that, it's very dangerous to really have a baby in Nigeria compared with some other countries of the world. So we are looking at why. Is it that we are not working hard enough? Or what we have been doing over the past 40, 50 years, why has it not reduced the rate at which these women die?
I'm Emeritus Professor Benjamin Chukwuma Ozumba, 14th Vice Chancellor, University of Nigeria, a Fellow of the Nigerian Postgraduate Medical College in Obstetrics and Gynecology, former Provost, former Dean of Medicine and Dentistry, University of Nigeria. Well, the event we are witnessing today is an annual event for all fellows of the National Postgraduate Medical College. especially in obstetrics and gynecology. And as you can see, it's a very grand event. Opportunity to meet old fellows, young fellows, especially for those of us who have had the privilege and honor of bringing to pass many eminent fellows in obstetrics and gynecology, professors, specialists, clinicians. Actually, at this meeting today, I'm the oldest fellow. Okay? And I'm particularly delighted, as I said earlier on, to be here because it gives me the opportunity of meeting old fellows like the president of this association at the moment, Professor Oke Ikpese, is actually my contemporary at the Teaching Hospital of University of Nigeria. And I have opportunity of seeing established persons like the current chairman of the sector in Enugu here, Professor Cyril Jim, those who have accomplished a lot. He's a professor of note, both nationally and internationally. And so many of them. I was sitting next to Professor Mrs. Ogu, now a deputy vice chancellor of one of our eminent universities. These are fellows who have had the opportunity and who have had the honor of mentoring in one way or the other as they pass through the faculty. So many of them, professors, consultants, clinicians, very successful specialists in their practice, highly successful administrators, scientists, and so on. So it's a very heart-warming event for me. Actually, to become a fellow is an arduous task. It's challenging. So I plead for them to be both diligent and resilient. There are many obstacles to pass through. You have to pass and get into residency. You have to pass your primary, the part 1 and then the part 2. And I have to chart a course for yourself. If you are going to be a clinician, keep up with your practice. If you want to be a specialist in the teaching hospital, continue. If you want to practice academic medicine, work hard, do your research, publish your papers so they can rise to high position. And if you want to be an administrator, you also have to work hard. And you have to, in some cases, play the necessary politics. You see, some of them are commissioners. And we hope that some of them will become ministers someday. And that will make us happy. Many of them are holding national assignments. Like you hear in maternal and fetal medicine. It's an occasion that gives joy. Yeah. Presently, Nigeria does not occupy an enviable position in maternal and child welfare. We have one of the highest maternal deaths in the world. So I'll prefer that if possible, we should have a state of emergency so that, as you said, the authorities will look at opportunity to crash it down. The present very high maternal deaths and neonatal deaths to one of the lowest. It is achievable. Records are being kept about deaths in different zones in the country. We will now look at the number and the factors that affect it. Is it lack of light? Is it lack of personnel? You know, Nigeria now has what they call Japa syndrome, brain drain. You train people out, they move out to other countries. So they don't even have enough personnel, both doctors, nurses, midwives, medicine, drugs, basic things like water, electricity. But these are things that can be dealt with if we focus. So we call upon the federal government to look into it. It is possible to bring down the very high maternal deaths to become one of the very low or zero maternal deaths in Nigeria. It's something that can be achieved if we look at it. Yes, I also call on my colleagues I've met here to put in their best, live with the ethics of the profession, to provide the best possible in their care, go the extra mile to reduce the very high maternal deaths, to give their best in training the younger ones, to give the utmost care they can to achieve this virtually zero maternal deaths that we are aiming at in this country. Those are my parting words to my colleagues and
I am Professor Ayodeji Ayotide, the faculty chairman for Faculty of Obstetrics and Gynecology, National Postgraduate Medical College of Nigeria. Yes, as the chairman of the faculty, I formed the committee, the LOC, for this faculty lecture day. Well, I didn't really meet any challenge. By virtue of my position, I formed a committee. The committee will report to me, and my job is just to approve. Once the money comes in, I approve the program. The challenge is, trying to limit the expectations and all the activities. We need to conform to the college rules and regulations. Otherwise, no major challenge. I didn't face any major challenge. Yes, maternal mortality is the bane of the society. Our job as specialists in obstetrics and gynecology, our first objective is to reduce maternal morbidity and mortality. That's our first objective. It's a recurring factor. It's not getting, the rate is not reducing. So we need to inform ourselves, inform, and teach ourselves the truth, and tell ourselves the truth. So that's the most important thing. It's a very topical issue, something that you can't do without. And I think it was given by the President of Sogon, who fortunately is also a member of our faculty. And it's important, mind you, we've done a lot of work, a lot of things. Government has put a lot of effort. The society has put a lot of effort, and the college itself too. So we need to remind ourselves of the importance and the objectives of reducing maternal morbidity and mortality. Thank you very much. Well, the major take home is to remind every obstetrician and gynecologist that our first objective is to reduce maternal morbidity and mortality wherever you practice, to exhibit the utmost professional attitude and ethics about the ethics of the profession. We need to focus and refocus on reducing maternal morbidity and mortality. There are no two ways to it. Our women folk are dying unnecessary deaths. So those of us who are in government, who are involved with policymakers, we should ensure that these things are done properly. So that's the message for today. Well, fortunately for me, this is my last faculty day lecture as chairman of the faculty. And it's a befitting way. I want to thank everybody, the LOC chair, and my Professor Cyril Deem. They've done a wonderful job. It's a beautiful LOC lecture day and lecture day celebration. I'm so happy, and I thank all of them for the good work and all the efforts they put in. And I wish all of us the best conference. And for going forward, I wish the National College, National Postgraduate College of Nigeria, and Faculty of O&G all the best in its endeavors. Thank you very much.
Yeah, my name is Cyril Deem. I'm a professor of obstetrics and gynecology at the College of Medicine, University of Nigeria, and I'm a consultant obstetrician and gynecologist at the Teaching Hospital, UNTH. I'm a fellow of the National Postgraduate Medical College of Nigeria, Faculty of Obstetrics and Gynecology. And today, our specialty is organizing our what they call Faculty Day celebration. I'm the chairman of the local organizing committee. So I'm in charge of whatever we've done here, working with my committee and the subcommittees. We organize and package this event that is ongoing now. And you can see, I think we've done well. Many thanks to all our donors. This thing is free, courtesy of the donations of our faculty members. Okay? So, the donors of our faculty members, that's why this is free for our members. And I can see we've done well. I thank the faculty board, the chairman and all the board members who made this, who supported us in every way everywhere possible to package this occasion. That's it. Thank you. Yeah, today we discussed maternal mortality at the crossroad. And we discussed why has all the interventions Nigeria has been putting in place to reduce the deaths and the incapacitations, why are they not working? That was what we are doing today. Well, Nigeria is a low resource setting, okay? And often, financing is the major issue in healthcare in Nigeria. So I think the current Federal Ministry of Health and the state ministries of health are doing their best to implement all the packages that are available now. Let's see, what we are encouraging or praying for is to improve our primary health care delivery system. Because if we are not able to do that, we won't be able to reduce maternal deaths, we are talking about. Likewise, if you are not able to improve financing, universal health financing means somebody goes to hospital, you don't need to pay. That is a situation whereby not having money is no longer a hindrance to achieving going to hospital. So those two things are key. Universal health coverage and financing, number one, and two, improving our primary health care. If we're able to do that, I think less women will die because of pregnancy. Thank you.
Professor Okechukwu Ibeze. I'm a professor of obstetrics and gynecology, and currently I am the president of the Society of Obstetrics and Gynecology of Nigeria, which has more than 2,000 obstetrician gynecologists in the whole country, and some of them in diaspora. Our association does a lot of work in women's health and sexual and reproductive rights. And our main aim is to keep the women healthy from inception to old age. That is our remit. And we are doing it in many ways, doing some projects, advising government, advising everybody, and taking actions to make women healthy. When the women are healthy, the family is healthy. When the family is healthy, the country is healthy and productive. So we don't like some of the bad statistics that come out of Nigeria. So our aim is to elevate our health, especially the health of our women, for whom we are the acclaimed voices. Thank you very much. Thank you very much. In conjunction with the college, we want to look at something that is topical, something that is important. In Nigeria today, women die during delivery, during pregnancy and childbirth. And the rate at which they are dying is alarming. And so every stakeholder is concerned. The women themselves, their families, the federal government, professional associations like our own, and what is more, the rate is the highest in the world. So because of that, it's very dangerous to really have a baby in Nigeria compared with some other countries of the world. So we are looking at why. Is it that we are not working hard enough? Or what we have been doing over the past 40, 50 years, why has it not reduced the rate at which these women die? So it's trying to be the voice of women's health, try to save our women so that we can eliminate all preventable maternal deaths and therefore be like other countries where it is safe to have a baby. So that is the essence of this lecture. So in this lecture, we shall interrogate the situation, know why we are where we are, what has been done, what works and what doesn't work, and how we intend to take action to save that situation. That is the essence of this lecture. And we'll be talking to experts, the professors, the consultants from all over Nigeria who are doing this work, because they're also critical stakeholders. And we shall have a very meaningful discussion and see the action, how to move forward.